The following program contains images of an actual surgical procedure that may be graphic and disturbing. Parents are advised that these images may not be suitable for young children.
Skin cancer is the most common form of cancer in the U.S., and if it's caught early, your chances of full recovery are very high. But no matter what stage it's in, getting the news can be quite devastating, as it was for Nicole.
I'm not gonna lie, I'm really nervous and scared. I just really didn't think that this would happen to me. Hi.
How are you?
Good.
Go ahead and sign on line 14 for me.
I just turned 30, and you'd think it's gonna happen to people who are older. I know it was from overexposure to the sun. I was a lifeguard for 3 years in a row. I was always outdoors, exercising, without a hat, with my hair pulled back. I put sunscreen on my face and my body, but I didn't put it on my scalp or my head. So I found Dr. Cohen and came in, and they found a spot on my scalp on the left side of my temple. I just really didn't think it was going to come back cancer. Those words, it's very startling. If I had waited longer, I don't even know what would have happened. I mean, thank God I came in when I did. I'm just nervous and scared, and I just want it over with.
Well, the waiting was probably the worst part for Nicole, but she was soon cleared and ready for surgery.
Good morning.
Hi.
How are you doing this morning?
Okay.
Good. I know we've spoken a lot about this. I just want to see if you have any questions or concerns.
Just like how much it's actually going to hurt.
We can certainly give you some pain medication. The first step is actually scraping the cancer cells off the surface, and then I'll take a scalpel and we'll cut right around the perimeter of the area. We'll actually remove some of the skin, and we'll be able to process it this morning. This is a very low-risk skin cancer. It's called a basal cell carcinoma. It doesn't tend to spread to other parts of the body, but does need to be removed. So if you don't have any more questions, I'm going to go ahead and we'll take you over to the surgical room and we'll get started. I'm just putting a little bit of margin around it with a surgical marker. So I'm going to score the skin, the bottom and the top. So you can see the small area that we scraped in the middle, and then a very small edge. You feeling okay? So at this point, we're going to stop. We've got our tissue specimen. It takes about 45 minutes to process the skin. We're actually going to look at it under the microscope. So Nicole, we still do have some tumor there. We're going to have to go back. We want to make sure that everything's out. Oh, great news. We got it all. Everything's out. So now we can stitch things up and make it look a whole lot better.
We're joined by board-certified dermatologist and Mohs surgeon, Dr. Joel Cohen, along with Nicole. Welcome to both of you. Welcome. So, are you relieved to know that it's gone?
I'm so relieved. I'm just thankful that it's gone, and that I caught it early.
So she's how far out from the surgery right now?
She's just about 3 weeks from surgery. And as you can see, the scar is settling down and looks very nice. And over the next couple of months, it's expected that this and some of the texture will settle down as well. Really, Mohs surgery offers the highest cure rates for skin cancer, up to 99%. So if we look at basal cell carcinoma, there's about a 1% recurrence rate. And for squamous cell carcinoma, there's about a 3% recurrence rate.
So, Dr. Cohen, there's so much confusion. Basal cell, squamous cell, melanoma. What's the difference?
So basal cell is actually the most common type of skin cancer. The cell of origin is here at the bottom part of the epidermis, which is the top layer of the skin. And basal cells typically appear as a grayish or pearly discoloration, often with little blood vessels at the surface. Squamous cell is the second most common type of skin cancer, and squamous cells usually appear red, rough, and scaly, and sometimes ulcerate and bleed. And it's important to distinguish those from a melanoma. Melanoma is the most aggressive type of skin cancer. One of the melanoma cells, which usually starts in an abnormal appearing mole, a mole that has irregular color or borders, And one of these cells can actually break off and spread to distant areas of the body. And one person in this country dies every hour from a melanoma.
What steps can we all take, can Nicole take going forward?
Broken record, but true. Sunscreen, sun protection, and skin exams. So sunscreen, use a broad spectrum sunscreen, reapply every couple of hours. If you're at the beach and wearing a bathing suit, it really takes about a shot glass full of sunscreen to cover the entire body. As far as sun protection, wear a hat. That can help prevent skin cancer of the scalp, but also sun protective clothing like a swim shirt. And lastly, skin exams. Self-exams every month, and annual checks with a dermatologist can catch things very early and prevent them.
And Nicole,
good tips.
Thank you for being here sharing this story with us because it's so very important. Dr. Cohen, thank you so very much.
Appreciate it.
Coming up.